Hello everyone, today our topic is the cubital fossa. The video is divided into three parts: introduction, boundaries, content, and clinical relevance. So, fossa means hollow depression, and the cubital fossa is a triangular hollow depression situated in front of the elbow. Now, let me explain it through the diagram first. As you can see, there is a triangular hollow depression known as the cubital fossa. This fossa has a hollow triangular depression, like every other triangle, with a base and an apex and two lateral walls. Now, this is the medial border and this is the lateral border. Now let's look into the cubital fossa boundaries. The boundaries are mainly made of two muscles. On the medial side, the muscle present is the pronator teres muscle, which makes the medial border. On the lateral side, the muscle present is the brachioradialis, which makes the lateral border. Now let's look at the triangle's apex. The pronator teres muscle from the medial border and the brachioradialis from the lateral border meet together to form the apex. Now let's look into its base. To understand this, we need this diagram. We saw that the lateral border is made by the brachioradialis muscle, which is its lateral side, and the medial border is made by the pronator teres, which is its medial side. The apex is formed by the joining of the medial and the lateral epicondyle of the humerus. You know that the humerus has two epicondyles, one medial and another lateral. If we draw an imaginary line from there, that forms its base, and this is the base of the cubital fossa. Now let's look into what makes the roof and the floor of the cubital fossa. The floor means what is present under the cubital fossa. Under the cubital fossa, there are two muscles, the brachialis and the supinator muscle. The roof means what is present outside it. So in it, there is skin, then superficial fascia, then deep fascia, and lastly bicipital aponeurosis. Superficial fascia, there are two things present. First is the vein and the second is the nerve. So, what vein is present? The first is cephalic vein and the second is the basilic vein. And what nerves are present? The nerve present are the lateral and medial cutaneous nerves of the forearm. Now, if I tell you with the help of this diagram, first let me tell you that this is the lateral side and this is the medial side. Now, on its lateral side, what do you see? Do you see the cephalic vein? And on its medial side, there is this basilic vein. And on its medial side, there is this basilic vein. Now, we are done with the cephalic and basilic vein. The cutaneous nerve is left. The cutaneous nerve is always present in the superficial fascia and does sensory supply of the skin. Here are two cutaneous nerves, one on the lateral side and another is in the medial cutaneous nerve, and another is the medial cutaneous nerve. Now we are left with the bicipital aponeurosis. As we can see, the cephalic vein and the basilic vein are joined by some vein. That vein is called the median cubital vein. Now we are done with all the boundaries of the cubital fossa. Now let's look into the second part of our video, which is the contents of the cubital fossa. To understand that, let's look into the diagram. The cubital fossa has four main contents. Let's start from the medial side. First is the median nerve. Then there is this brachial artery, which terminates into the ulnar and radial arteries. Other than that, there is this tendon of the bicep brachii, and there is radial nerve. Now, the median nerve and the radial nerve inside the cubital fossa gives off a few branches to muscles. The medial nerve gives branches to three muscles: the flexor carpi radialis, the palmaris longus, and flexor digitorum superficialis. Then the radial nerve gives two branches: the posterior interossei nerve and the deep branch of the radial nerve. The deep branch of the radial nerve supplies two muscles, the supinator and the extensor carpi radialis brevis. Now let's look into the brachial artery, which terminates into the radial and the ulnar arteries. The radial arteries gives only one branch, which is the radial recurrent branch. The ulnar artery gives three branches, one anterior, one posterior which are both recurrent branches. And the third one is the common intraosteal branch. Now, all of these are the contents of the cubital fossa. Now, our last part of the video is clinical relevance of the cubital fossa. So, like we already discussed, and you know already that here is there a median cubital vein present. Now, this is the same vein where we inject intravenous injections. Apart from that, in the front of the cubital fossa, the brachial artery is present. Now, remember that whenever we want to check blood pressure or BP, universally it is checked by our brachial artery, which is present in front of the cubital fossa. Now, the cubital fossa is useful while dealing with fractures around the elbow. Now, let's talk about the axillary artery. Axillary artery palpation is done in the lateral wall of the axilla. Now, in the axilla, the clinical point is that it has abundant axillary hair. Infections of hair follicle and sebaceous glands give rise to boils, which are common in this area. Lastly, I hope you understood everything about the cubital fossa. Thank you for watching, and we will see you in the next video.